Steph, I'm gonna share my screen first.
Okay. Do you need me to stop sharing?
No, I think it'll just put it right out.
Okay.
Okay, good morning, everyone, and welcome to the New England Federation of Humane Societies special webinar today. Can I catch that? Zoonotic Diseases Part 1 with Dr. Stephanie Magnarelli, member of the New England Federation of Board of Directors, as well as veterinarian at the Animal Rescue League in Bedford, New Hampshire. I'm going to do a few housekeeping items and then I'll give Stephanie a formal introduction. But I just want to remind folks that we do have more engagement opportunities coming up soon. We have our leadership series next month with Trust Me With Your Work Life. Natalie Wild, Associate Director of the Shelter Employee Engagement and Development Survey, also known as SEEDS, will be with us to discuss how shelter leaders can foster employee trust and the benefits of doing so. We also will have another great session in February for the leaders in our field. And for your frontline employees, we do have another Can I Catch That session with more information on cleaning and disinfecting back with Dr. Magnarelli again. So hopefully you can join us for that in January as well. We are also just wrapped up collecting our RFPs for our upcoming conference in the spring. We're really excited to be back in person with everybody, and we hope to see all of your faces there. We'll be in April 15th to 17th in Hartford, Connecticut. So we hope that we will see a lot of your organizations represented to come together finally after a very long time being apart. Dr. Magnarelli is the Chief Medical Officer at the Animal Rescue League in Bedford, New Hampshire. She knew she wanted to be a veterinarian at a very young age and began getting involved with animal shelters near her hometown of Topsfield, Massachusetts. By the time she reached high school, she got her first real job at an animal shelter, and she knew she didn't want to be just any veterinarian. She wanted to be a shelter vet. She attended Franklin Pierce University and then went on to Ross University to obtain her DVM. After spending a couple of years in private practice, Dr. Stephanie came to the Animal Rescue League New Hampshire in 2008 as a shelter veterinarian. A few years later, and she's now on the leadership team as the Chief Medical Officer alongside Marianne, the CEO at ARL, and the three of them, also with Naomi, the COO. The three of them work very hard and keep the shelter running smoothly and healthy, thanks to Dr. Magnarelli. We would like to thank Stephanie for being here with us today. We are really excited about this session. I think it's important information to get out, to everyone. So we will move right on. I'll thank our sponsors today as well, MSPCA Angel and PetSmart Charities. If you have any questions, please feel free to pop them into the chat as we go. And also tell us where you're watching from and what organization you're with in the chat. Thank you so much. And I'll turn it right over to Dr. Magnarelli.
Thank you, Crystal. All right, get my screen back over here. Nope. All right, can you all see that okay? Let's see. So can I catch that? So thank you to the New England Feds for having me here. And
sorry, Dr. Magnarelli, I can't actually see your share.
Okay, let me go back here. I think I have to request a share from you.
Sorry about that. You should have the ability.
All right, how's that?
There we go.
All right, perfect.
Perfect.
So thank you guys again for having me today. This presentation is called Can I Catch That? Here's my information here. My email is at the bottom. If you have any questions, just in case I go over time, or a lot of people I'm sure watch this after the fact, and you can certainly email me with any questions or comments, or also if you want to send in some questions for the following Can I Catch That? Presentation, which is going to be at the beginning of next year. So I have not put it together yet. So if you come up with any questions based on what I present on today, then let me know. So I made this presentation keeping in mind that we have a lot of new staff in animal shelters today. At my shelter, for sure, we have a lot of newer staff, some people that have never worked in animal shelters before, some people that have never even worked with animals before, which is great to welcome these new people to the field. But we definitely want to share some of the information that people that have been in this field for a longer time may already know, they may be very familiar with. And it's tricky coming into this field and not knowing all the different diseases that animals can catch, and also that you can catch from animals. And it's some important stuff. So I wanted to go over that. And hopefully we have a lot of new people here today that can gain a lot of information, or some people that have been here in the field for a long time and just wanted a little bit of a review. So you start working with animals, you start learning about bacterias and fungus and parasites and viruses. These are all things that might be new to you. You know, you're learning the words for the very first time. There's hookworms, there's whipworms, there's roundworms, there's ringworm, but ringworm's not a worm, and it's all very confusing. So we're going to kind of dive into this, and I color coded a little bit of everything just to kind of give you a feel for how scary is this. And spoiler alert, I am going to not scare you that much. I am going to tell you that a lot of these things you're probably not going to catch. I've been working in the field for a long time, and I've had minimal issues, I'll say, catching things from these animals. And a lot of the things that you read on websites, you know, there's a lot of liability. They have to tell you that there's always that possibility. So I did this color coding with, yes, you can catch that. If something's red, be careful. Use your, you know, PPE and everything that you've learned from COVID to, you know, spill over into the animal world of being careful, using those gloves, and making sure that you're not exposing yourself. There are going to be other things in yellow that are pretty difficult to catch, but possible. So again, go slow, tread lightly, but don't panic about it. But the number one rule is never say never. So when you see that green light, you're probably not going to get it. But I'm never going to say that you will never get it, because then you can sue me. So I'm going to kind of keep this a little light, and you know, make it so that you're not scared by the end of the day of what you're going to be catching in the animal shelters. But you know, you still want to use caution, use your best judgment. So we'll start with some ectoparasites. So those are parasites that are living outside of the body. And fleas is a pretty simple one that I'm sure most of you have heard of. There are different life cycles of fleas. So we have over here the eggs, larvae, pupa, and adults. And these adults are more what you're probably seeing with the naked eye when you're looking at the animals. So you can see them on cats, you can see them on dogs. Sometimes you don't see them at all, and actually what you're looking at is called flea dirt. So that is actually the feces from the flea. It looks like little specks of dirt. And then you know that that animal has fleas, but you're not actually seeing the live flea on the animal. They can jump pretty far and pretty fast, and that's how they're going to move from one animal to the other. They can actually detect heat and movement. So in the outdoor world, they're going to kind of hang out and burrow by like rabbit holes and stuff like that. And then when they feel that animal move or they detect its body heat, they're going to jump right onto them. Can you catch them? Really unlikely. So fleas will bite people, don't get me wrong, but they don't want to. So when you are in the shelter environment, you have that cat on an exam table and you see they're covered in fleas and you get all itchy, those fleas aren't going to travel on you. They're not going to jump on you and follow you around for the rest of the day. They're not going to go home with you to get onto your animals. The time that you're going to catch fleas from a cat is when you own 56 cats in a small 1-bedroom apartment and you're sleeping with all of them on your face. That's when you're going to get bit by those fleas. So it's really those overwhelming populations of fleas, that there's just so many that they end up biting you amongst your 56 cats. But again, if you have that one cat, or even if you have a hoarding case of cats that come into the shelter, those fleas aren't going to want to stay on you all day long. They're going to jump right off. So don't worry about them too much. Other animals can certainly get it. So it is something that in the shelter environment, you want to make sure that all of your animals are up to date on preventatives. And fosters, this is a big one for foster care. So if you have animals that are, you're sending straight to foster care after they come in. So think of those like few-day-old kittens. You don't want them to stay in the shelter environment. You want to send them right to foster. If they have fleas on them, they can bring the fleas to the foster home. So make sure that your foster home has, if they have animals at home, they keep them up to date on preventatives as well, because you can certainly transmit the fleas from those kittens into the, like other cats or dogs inside that foster home. The other big problem with fleas is that most of the infection is actually not on the animal. It's generally only about 5% of the infestation is on the animal. So when you see this flea on the animal, that's only 5% of the problem. The other problem is in these stages here. So these eggs, they're going to be laid into like the little cracks and crevices inside the house, inside the couch, all of that. So the best way to get rid of a flea problem, you've got to get it at the source. You do want to give the preventatives to the animal, but after that 1 month of preventatives, these eggs here are going to hatch, and then they're going to make a new adult eventually. So then that new adult is going to try and jump back on the animal. So you need to get rid of the eggs in the house, which is going to be like vacuuming. I try and stay away from those like flea bombs. There's a lot of chemicals in those, but I have known some people that had to use them, and felt like they did an okay job, but they are dangerous to the animals. You want to get the animals out if you have to do something like that. And you want to give 3 months of preventatives on those animals that have fleas. That's going to give you, that first month is going to kill all the adult fleas that are on the animal when they arrive. Then a month later, when these eggs hatch, those adults are going to jump back on. You're going to have that second month of preventative that's preventing them from going back onto the animal. So that's why you don't want to just give that 1 month of preventative and then forget about it for their life. You want to keep going with 3. You get that, that third month is kind of just your bonus. So that's what I usually recommend to people if they have fleas. Also, if you're sending home animals that came in with fleas, it's a good idea to send them home with some more preventatives, not just give them that 1 dose in the shelter. So when you're thinking about fleas, this is the classic picture here. Fleas like this back half of the animal. So whether it's a cat or a dog, you tend to see them right around this area, right at the tail base. If you see a lot of hair in that spot, you kind of know that you have fleas. And one thing I had mentioned earlier was the flea dirt. This here is a picture of flea dirt. So you can kind of see like little specks of dirt. And one little trick that you can do to help differentiate regular dirt from flea dirt is you get it wet, you spray it with like anything, rescue, water, alcohol, anything. And you notice that, see how there's this little red area around it? So that shows that this is flea dirt, not regular dirt, because the flea is eating the blood from the animal, right? And the flea dirt is actually the poop from the flea. So this is actually blood that is kind of seeping out of the flea dirt. And that can kind of tell you that that's flea dirt, not just regular dirt. So if you're looking at an animal and, you know, maybe you don't see any fleas, and then the animal leaves that exam table or wherever you're standing and you notice a lot of dirt left behind, just spray it down and see if you see that red tinge around it. And that will tell you that it's actually fleas. It's not just dirt, because sometimes it can be tough to differentiate. Ticks. A lot of people are probably familiar with ticks, but then they're pretty similar to fleas. They have their different life cycles. And they kind of do the same thing, that they detect your body heat, they climb on you. They're a little bit easier to see than fleas, which is good. You can pick them off a little bit easier. So that's one good way to get rid of them. But the preventatives are going to be the other important thing, to keep preventatives on the animal to prevent further fleas and kill off any fleas that are, any ticks that are living on them. If you've ever hiked outdoors in the woods, you know that you can catch ticks. But again, this is something that is going to be very unlikely that you'll catch it from the shelter environment. So an animal comes in with a tick on them, you're either going to find it and squash it. You're probably, it's not going to jump on you and carry home with you. That's pretty unlikely for something like that to happen, especially if you're putting preventatives on the animals that come in. And ticks come in all different sizes. So you can see some of them are very, very tiny, and they can be hard to pick out, especially off of a large dog or cats that have long hair. It can certainly be difficult to find them. And that's why, again, it's important to have those preventatives on. And this picture here is just a little reminder that animals do not actually get the bullseye appearance with Lyme disease. So dogs do get Lyme disease. And when people get bit by a tick and get Lyme disease, they get this bullseye looking kind of rash like that. And dogs do not get that. So I've had people tell me pretty often, oh, my dog got bit by a tick, and here's this red patchy spot. I think that the dog has Lyme disease now. And that's not something that they get. So they may have a rash, they may have that like red looking spot, but that's just from the bite of the tick. It does not mean that the dog now has Lyme disease. And there's not much that we can do at that point to know if the dog has Lyme disease right after they get bit by the tick. So you don't have to panic and, go and let the vet know if you have a dog that has a tick on them. You don't have to panic about it at that point. It's not going to show up in any blood work for a while, so we can't do much about it other than just take the tick off of them and keep an eye out for any more. Mites are the next category of those ectoparasites, and there are lots of different types of mites. So there's scabies, demodex, ear mites. Those are some of the very common ones that we see in the animal shelters. This guy down here is a little demodex mite that's underneath the microscope. So one big difference between the last two is that these mites you're not going to see with the naked eye. You're going to have to look under the microscope to find them. They do spread with close contact, but again, pretty unlikely that you are going to catch them from animals in the shelter. They're usually pretty species specific, so usually they like to stick with the same animal. So if you have a dog mite, they're going to want to stick on a dog. So it's not common that they're going to want to go over to a human. But the other animals, other dogs, so say you have like a litter of puppies, they can certainly spread it in between each other. And there are, lots of different things that you can do for them. Again, the preventatives, medications, there may be something like ivermectin or something that your vet may prescribe for them. And same thing with ear meds for ear mites. So now we're moving into the endoparasites, so the parasites that are on the inside of the body. Starting off with coccidia is a pretty common one. So coccidia is the one you want to think of when you have like a litter of kittens or a litter of puppies. You see it a lot in these younger animals. It's a protozoa is its classification, and it's spread by the fecal oral route. So basically, these puppies, they're pooping and then they're, walking through it, licking their paws. That's how they're catching it from each other. And that's also why it's pretty unlikely that you're going to catch it from them. Again, it's one of those that's pretty species specific, but it is the fecal oral route. So if you're washing your hands pretty well too, it's tough for you to catch it. Other animals can catch it though. So other animals in the same species. So there's another important one when you're thinking of your foster homes. You're sending home a litter of kittens, they have coccidia. You may actually find that foster home continues to get coccidia with every litter of kittens that you send to them. Because it's pretty tough to kill it in the environment. So it's not the end of the world. You just need to kind of know when that happens. If you have those foster homes that are coccidia positive foster homes, maybe you don't want to send the most fragile of kittens to them if they don't already have coccidia. Just kind of keep an eye out on that. But again, it's pretty easy to treat with our Albon or Marquis paste or some of the treatments that your vet may use, some of the medications. So just, keep going with those medications and keep an eye out for those foster homes. And here's a picture here under the microscope with the classic look of a coccidia poop. So they're going to have that orangey, yellowish kind of look to it. And it has a pretty distinct smell too. So once you get to be familiar with it, you'll know that those kittens have coccidia, whether you can see it on a fecal sample or not. So now we're moving into the hookworms, roundworms, whipworms. These are all also endoparasites, so parasites that are on the inside of the body. And these ones, as you can see, they're yellow. They are a little bit easier to catch, I would say, but proceed with caution, but don't go running and screaming from the building. You don't have to be that concerned about it. Again, it's the fecal oral route that they are spread mostly between animals. Although with humans, one of the more popular ways to get it is actually through the soil. So you can actually get a cutaneous larval migrans is what it's called, where it actually goes through the skin instead of the way that you see it or you think of it in animals between the fecal oral route. Other animals can catch it too. So these are things that you want to watch out for in your dog yards, making sure that you're cleaning up really well out there. If you find some animals that are positive for any of these worms, you want to clean out that yard really well afterwards. And if you do something like if you take transports or something like that, just use caution with those situations. If you're bringing in animals that end up having parasites, especially from other states, make sure you're cleaning up the yard really well or isolating those animals until you know that they have a negative fecal. Most of the time you're going to be treating it with like a panicure is a very common one. And again, cleaning up the fecal material outside in the yards and really bleaching out the yards as well. But again, don't go running from the building. You're not going to be at a huge risk for catching something like this. And if you are, honestly, it's going to be right here in the sandbox. That tends to be the spot where people catch these types of worms. It's more common in other areas where it's, well, I guess I don't know if everybody here is from New England, but the warmer areas and either other countries too, where it's a lot warmer and wet. And that's where you're going to find these things living inside the sandbox, inside the soil. But again, keep an eye out for it in your dog yards as well. On to tapeworms. Tapeworms is a little bit different. They are a little different than the last worms. They are also an internal parasite, but they are actually spread through fleas. So you may see them a lot. They look like these little tiny grains of rice. So this picture here is a long tapeworm that is actually inside the body. But when you see them on the outside, you can find them sometimes just inside the litter boxes or around right around the like tail area. If an animal goes to the bathroom and has like a tapeworm segment on them, it's just going to be one little piece of this. So it's not going to be the entire worm. The majority of the time when you see a tapeworm, it's just going to be these little tiny segments. And again, it spreads by fleas. So they're actually getting it by ingesting the fleas. So think back to that first picture when you had the cat that had that completely naked bottom half. They were, lost all that hair from licking because of fleas. Those cases, you want to also treat them for tapeworms, kind of catch it before you even see it, because tapeworms are sometimes hard to find on a fecal sample. Their eggs are actually a little too heavy for them to float up for a fecal float if you do those in-house. So it's important to kind of just get ahead of it and treat them, even if you're not seeing them in cats that or dogs that have fleas. That way you don't end up sending that animal home and having the owner freak out that they're seeing worms move around in the animal's stool. It's unlikely that you're going to catch it for two reasons. First of all, it does need that intermediate host in order for it to cause a problem. So you're not going to get it from eating the tapeworm segments, but also you hopefully are not eating fleas as well. That's pretty difficult. So highly unlikely that you'll be catching it. And it's actually highly unlikely that the other animals are going to catch it. So again, say you send that animal home, maybe you didn't even know that they had fleas, and you sent them home, and then a few days later the owner calls and says that they're seeing these little tapeworm segments inside the stool. Well, you don't have to really worry too much about their other cat that they have in the house, because you've already treated them for fleas, so they're not bringing fleas into the house. Then their other cat is not going to get tapeworms from the cat that they adopted from you. So it is unlikely. I can't say it's not possible, because again, fleas are one of those things that they will share fleas. So if you don't put those preventatives on and they bring fleas into the new home, then the other cat could get fleas and then end up getting tapeworms. But it's not like other worms where they'll spread it the fecal oral route, and if they're sharing a litter box or something, that they'll end up sharing tapeworms. So you don't have to worry about that one too much with tapes. And Droncid or Drontal are a couple of the medications that you use to treat it. These are luckily pretty much a one and done treatment. So a lot of the times we will give an injection of Droncid when they're in surgery, if we see tapeworms around their rectum while we're doing surgery, and then you're good to go. So it's not one of those that's going to hold them back at the shelter too long. And here's a nice pretty picture. I get pictures like this sent to me all the time, just without any warning, of just like an up close cat butt. And if you're new to the field, I hope that you've already been blessed with those text messages. But if you haven't, be prepared. This is what you're in for. Here's a nice tapeworm segment here, this little guy. And this is a nice fluffy cattail. You can see a couple here. It's usually pretty easy to pick up on these long-haired cats because it sticks to the hair pretty well. So again, if any of you are eating lunch, they look like a grain of rice. That's one of the best ways to describe it. And you'll often see them moving still too. So if somebody explains to you that they're seeing a worm, and usually my first question to them is, it rice or spaghetti? That's going to help you identify what kind of worm you're dealing with. So tapeworms, that's going to be the rice looking worms. Kennel cough. So you may be a little surprised to see this in yellow, meaning that it is something that possibly people could catch. Kennel cough is something that is just a very general, broad term for a respiratory virus in dogs. That coughing is one of the main symptoms, and it is infectious, so they can spread it between each other. And the reason that I say that maybe you could catch it is because we never really know exactly what it is. It might be bacterial, it may be viral. We don't actually culture it to find out. So some of those, probably not most of them, but some of those bacteria or viruses are things that people could catch. But again, we're just not actually culturing them to find out. So if you're seeing a lot of coughing between the dogs in the shelter, use caution, wash your hands. Again, not something to freak out about because there's a couple of different paths that would have to happen in order for you to catch it from them. It would have to be a strain that humans can get, which is probably unlikely, but possible. And then you have to actually take in those contaminated, like droplets or something like that, the saliva, which that's probably pretty easy to do. I'm sure you get licked in the face all the time. But a lot of times, if you're generally pretty healthy, then you're not going to catch it. So don't panic about it. Just kind of use your best judgment. And also, use your best judgment more for the animals, because you're going to be spreading that between dogs a lot easier than you're going to spread it between yourself, like catching it yourself. So make sure when you have close contact with dogs, if you're doing like play groups and stuff like that, just make sure that nobody's coughing. If they are coughing, you want to stop those play groups until that their sickness is over. Contaminated items, so making sure that you're really cleaning off all sorts of toys and play areas outside in the yard. Make sure that you clean those things really well. And some of it's not easy to prevent either, because it is aerosolized. So you can have, especially if you have any sort of chain link fences, and dogs are seeing each other next to the fence, they're going to be able to spread it pretty easily, just coughing or sneezing across the fence. So it's not always something that we can prevent it spreading, but just try to help them out as much as possible. And this kind of goes for you as well. If you're feeling a little under the weather, if you feel like you have a cold, then you should stay home, because the same thing, you have not cultured what you are sick with. So is there a possibility that that bacterial or virus could be spread to the dogs? It's very possible. So definitely use your best judgment. I think a lot of us kind of have already switched over to that post-COVID, but if you're feeling ill, just make sure that you're not spreading it to the animals as well. And vaccination too. So, getting rid of it, depending on what it is, maybe antibiotics, maybe you just need to do some supportive care with cough suppressants. Isolating the animals and vaccinating for kennel cough is important in our kennel type environments. And similar to kennel cough, in our cats, we're seeing upper respiratory infections. We see that all the time. Again, maybe a little surprising that I made it yellow, but it's for the same exact reasons that we're not culturing what these cats are getting. We don't exactly know what's causing it, whether it's a virus, whether it's a bacteria. And we can make some good guesses. And most of the time, it's not something that people are going to get, but never say never. So just use your best judgment when you see cats like this that are full of snot and they're rubbing it all over you. Just wash your hands afterwards. If you're immunocompromised for any reason, maybe you want to wear a mask around them. But the biggest concern is going to be spreading it to the other cats. So use caution, dress up in your PPE. Don't spread that around the entire shelter. If obviously, again, it's the same situation that it happens. It's not entirely preventable, but you're going to thank yourself later for spending the time to switch those gloves when you're not medicating every single cat that's in the shelter. So use your best judgment there. Let's see, Parvo and Panleuk. So this one is a really important one in terms of spreading it between the animals in the shelter. Another thing, unlikely that you would have any problems with it, but it is a virus. It's spread by close contact or contaminated items. So you can see this puppy in the picture here. You can see all that fecal material that's here. If he's dancing through it with those paws and then walking through the shelter, you're going to spread it very easily. But it is species specific. So your canine parvo is going to stick with your dogs. Your panleukopenia is going to stick with your cats. Luckily, panleuk is pretty rare these days. I should knock on every piece of wood around me. But we need to do a good job with our vaccines. And these animals are going to take a lot of supportive care, a lot of isolation. And one thing we'll go over in the next talk is going to be how to gown up for these animals and make sure that you are practicing the best PPE and using the best safety practices in order to make sure that you're not spreading it throughout the shelter. Because this is a dangerous one. Again, it's not one of those that is dangerous for you, but it is very dangerous for the animals at the shelter. So if you're new to the shelter world and you say this word out loud, everybody's going to think that you're swearing. It's one of those that nobody wants to hear, and we hope to keep it out of the shelter as much as possible. Heartworm is a big one that we're seeing a lot, especially southern shelters, or if you're getting animals from southern shelters. Uh, we're hearing about heartworm all the time. It is a parasite, and it's spread by mosquitoes. So you can see in the picture here, here are our adult worms right there. But the way that they're going to get there is through an infected mosquito. Um, can people catch it? Unlikely. There's not any studies showing that they can. Can other animals catch it? So this is one that I like to say, technically, you can spread it from dog to dog. So the way that, again, the way that they're going to get it is through this infected mosquito. So say you have this dog here, he's heartworm positive. He just came up from the south not long ago, and he's in this kennel. And next door, he has another dog, heartworm negative, no issues, doing well at the shelter. This mosquito comes over and it bites this infected dog. That's how this mosquito is getting infected, right? And now this infected mosquito is still inside your shelter and nothing's stopping it from biting the dog in the kennel next door. So can they transmit it from dog to dog? No, this infected dog is not going to give heartworm to his next door neighbor. But having a dog that has heartworm inside the shelter is technically a little bit of a risk towards those other dogs. The way that you're going to lower the risk is your preventatives. So you want to give that monthly heartworm preventative. That's going to keep the other dogs in the shelter safe. But also, if you have a heartworm positive dog in your kennel, you should also think about this mosquito repellent as well, just to prevent any further possible exposure of this mosquito that's going to bite your heartworm dog and then go over to every other dog in your kennel. It's not super easy to spread, especially again if they're on preventatives. You're doing a lot for them already, but heartworm's not one to play around with either. So you want to use your best safety precautions as you can, and try and prevent any further issues before they start. And the one you've all been waiting for, ringworm, which is not a worm, it's a fungus. So surprise if you're new to the shelter world, that's the one that everybody gets tripped up on. Just keep that in mind as if you're a veteran to the shelter world, or, as you kind of gain experience and you start to learn more and more, just think of how your adopters are thinking of the words that you're saying, because if you're saying ringworm to an adopter, they're going to think worms. So you kind of have to think back to those times that you didn't know that ringworm was a fungus, and help them, explain to them what they should be looking for, because it is one of those ones that tricks everybody up when they first enter the field. It spreads by contact. So these are the things that you never want to see. These little circular lesions, they're kind of crusty. There's hair loss. A lot of the times you're going to find them right around the face and on the feet are the most common, sometimes around the ears. And you can certainly catch it. So that's why this one is red. This is one of the biggest ones in the shelter that you need to worry about as a human, that you're going to catch from them. Don't panic. I have had ringworm multiple times. It's not the end of the world. You're going to have a little itchy spot on your arm. Well, I had it on my arm. I got rid of it within a few weeks. I don't think I ever even treated it. This was years ago. So it's not the end of the world. But the bigger concern is going to be if you have it on your arm or your hand or, wherever, then you're going through the shelter and you're still taking care of all of these other animals, then you can then be just spreading it everywhere. So this little tiny spot here next to the cat's eye, there are a bunch of spores all on it. Those spores are going to be falling off into the environment, and that's how you're going to be spreading it everywhere. So any animals like this that you see, you want them to be examined by your vet. Make sure that they're checked out for ringworm. If they're positive, you need to use all of the PPE that you have. Keep them in isolation, keep them far away from other cats. It's a big one in cats. Dogs can catch it too, but they don't tend to have the systemic issues with ringworm that cats do. So dogs will tend to get it and just like in one spot, and it just kind of stays there and then it goes away on its own if you don't treat it. Cats, they'll kind of get like this. You'll see it all over their face. You'll see it all over their feet. They can get, they can get pretty bad from it, and they can spread it a lot easier to other cats than you tend to see with dogs. It's honestly a bigger problem in the shelter than it is in homes. So once this animal goes home, it's, a lot of the times without the stress of the shelter environment, they can actually clear ringworm on their own. But in the shelter environment where you're going to be around all these other cats, you need to practice your best, safest precautions. So if you have somebody that's calling the shelter that thinks that their animal has ringworm, or just adopted an animal that has, they think has ringworm, then you want to just use your best judgment on how to have that animal, if they're coming back into you to be checked out or something like that. You don't want them to be kind of paraded through your lobby and your cat room and all over the shelter. You want to try and keep it as close quarters as you can. So bring them straight into whatever room that you can isolate them into, that your shelter has available, so that you're not spreading it to other animals. It's also one of those that you see in warm, wet environments. So think of those southern transports again. We get cats from southern states, and we do tend to get a lot of ringworm from them. So do your diligence when you're taking in those transports. Give them an extra look around their face and their paws. Make sure that you're not just throwing them into a cat room with all the other cats. They need to be quarantined, and you need to make sure that they don't have any of these lesions before you get them all set up. And if you do see these lesions, you want to make sure that they are isolated. They need to have proper signage on them to be isolated so that people don't just run into the room and touch things and then go out and spread it to other areas. And if you haven't had the pleasure of smelling lime sulfur yet, it's only a matter of time for you, and it will definitely ruin your appetite. And that is the treatment for ringworm. So if you think that bathing cats is fun, just think about bathing cats in smelly water. It's even more of a delight. And so it can be quite a long treatment for these guys before they are cleared from ringworm. So again, just the importance of making sure that you're not spreading it everywhere, because you're going to be real upset when you have to bathe every cat in the shelter. And then your itraconazoles or your fluconazole may be the medications of choice from your vet to treat these animals. So that is all the information I have for you today. I just put a couple of helpful resources here of different websites that I like to use to kind of look for more information on things, or sometimes they have nice handouts for adopters. So if you have those cats that came in with ringworm and you don't have 5 hours to explain it to the adopter of what it is and what you did and what to look for and all that stuff, you can use some of these websites, have some good handouts and different pamphlets that you can send them home with. This glorious picture is one of our most, no, I shouldn't say most recent, one of our many lime sulfur dipping days. So we've got a case with a bunch of kittens here. You can see this is the lime sulfur that I was talking about. It comes in this beautiful yellow color here. And our rescue that we're spraying everything down with, not the cats, but all of the, the rest of the environment, throwing out all of these towels and stuff like that. We don't reuse any of that stuff once they've come down with ringworm. And we only have smiles on our faces because we used this picture for an appeal for people to give us money, because they should feel bad for us for having to smell lime sulfur. So that is everything I have for you. We have again, part 2 is coming in January. If you have any questions or comments, or you want to give me some sort of like thoughts on what would be helpful to add into that PowerPoint, you can certainly email me. It's good to kind of gauge what level people are at, or what things that they're like, oh, I just started here and I have no idea how to do this, but I'm embarrassed to ask people. You can certainly email me and I can put it into the next PowerPoint so that you guys can benefit from that as well. All right, any questions?
Thank you so much, Stephanie. This was really great. And I know I'm going to share this recording with my new staff, because we have a ton of new staff members at my shelter. So I'm looking forward to the next session as well. I don't see any questions in the chat. So I guess I'll give another minute. If anyone has questions, please feel free to pop them right in. I do just want to say thank you to Stephanie for presenting to us today. It was really fantastic information, and I look forward to next month. We have a Facebook page that you can follow, and a group where you can keep this discussion going. If you have questions for Stephanie, just pop them onto the Facebook group and we can send them over to her and add them into the next session, or you can email her directly. But it's nice to kind of sometimes get on that group page and discuss things with your peers too. We also have an Instagram. You can follow us. We'll follow you back, and tag us in all the innovative things you're doing, and we'll share them. We want to promote all the good work that we're doing in the field, and really, let people know that New England's happening place for sheltering. You can also sign up for our e-newsletter and find out about all of our webinars and leadership sessions, as well as the conference that we have coming up. You can check in for the leadership series next month in November. Trust Me with Your Work Life will be presented. And then we have our second Can I Catch That seminar in January. And then we have some more great stuff coming up in February and the spring. So definitely stay tuned to our website and our e-newsletter to get all that information sent right to your inbox. We'll also, like I mentioned before, have our annual conference in person again in April in Hartford, and we hope to see you all there. We hope to see a lot of organizations represented, and just have an opportunity to come together finally, now that people are spending time in person together, and really enjoy some amazing sessions. We're going through all of the wonderful submissions that we've gotten right now and selecting a fantastic lineup of sessions for the conference. I'm really excited about all the fantastic options we have coming up. So check that out and sign up soon.
Hey, Stephanie, there is one question in here. Jennifer's wondering if cats that previously had ringworm are more susceptible to it in the future.
Nope. No reason that they would be more susceptible to it in the future. It's just a matter of the spores and whether or not they stay on that cat. So if you have a cat that has ringworm in the shelter, you want to make sure that all of those spores are off of the cat before sending it home. Because what can happen is sometimes you can have a cat that has spores on them. You've treated them and they don't have any lesions, so you don't see that spot of hair loss, but they still have those spores, which you can't see unless you're looking under the microscope. So that would really be the only reason that you have a cat that continues to test positive but doesn't have any spots of hair loss.
Thank you. Does anyone else have any other questions? All right. Well, I hope we'll see a lot of you in next month's session, and then we'll have a few months, we'll have December off and come back strong in January to talk more about PPE and preventing spread of all this wonderful stuff throughout our shelters. Thank you so much, Stephanie, and have a great day, everybody.
Thank you.